Well, that's a complicated question. There's going to be no one simple solution. As I mentioned earlier, opening a dialogue with your patient so that you as a physician can understand what your patient's concerns are, as well as places where you as a physician can caution your patient about what potential problems lie ahead, is a good first step. There are going to be circumstances where there are more expensive and less expensive alternatives. Considering those from the patient's perspective may be very important. There are going to be situations where one treatment may be very slightly better, but very more substantially expensive. And if that cost is going to impact that individual patient, that patient needs to be involved in those decisions. You might be surprised what choice that patient makes. Some patients will consider the financial aspects and others will feel that it's not appropriate. But not making your patient aware of these options would be similar to not discussing two options where one may have slightly more effectiveness but dramatically more physical toxicity. If a patient's going to be at much greater risk for nausea, much greater risk for hair loss, much greater risk for chronic fatigue, and might give up a little bit of efficacy for a treatment that would have lower risks of those things, that's a choice you would want your patient to be able to make. Similarly, if there's going to be a very substantial financial exposure for your patient versus versus options that have less, and that's going to be important to let the patients know about.